Orty, and I'm the director of the Colorado Gerontological Society. And in this session, we're going to talk about Medicare supplements and Medicare Advantage and what the difference of these are and what that means. So it's important to know that Medicare has parts A, B, C, and D, and insurance companies, Medicare Advantage companies, prescription drug plan companies, and Medicare supplements all sell plans. So we have the difference of plans versus parts. And what gets confusing is that they use the same letters sometimes. So that's sometimes a challenge as we're trying to keep those separate. Just quickly over an overview. So we have original Medicare here, and original Medicare is Part A and Part B. Part A covers inpatient hospital, skilled care or rehab in a skilled facility if you have a 3-day inpatient hospital stay, as well as skilled home care if you have a 3-day hospital stay and hospice care. Part A does not ever cover doctor's visits, and it only covers prescription drugs if you are in a hospital setting. In a skilled nursing facility or in the home care or assisted living, you have to use your Part D coverage. Part B then covers doctors, specialists, labs, x-rays, ambulances, emergency rooms, wheelchairs, CPAP machines, oxygen, preventive services, those kinds of things. Part C then is Medicare Advantage, and it covers A and B, and sometimes, most of the time in our state, it has a prescription drug benefit as well, but not necessarily. So Part C is basically, it covers A and B, original Medicare. So you get everything you get with original Medicare. What happens though in a Part C plan is that anything that Medicare does not cover, you either get charged an out-of-pocket expense, or you get a copay, or you get charged the 20% that Medicare doesn't pay. And then that's up to a certain cap. Sometimes you also will get dental, vision, and hearing items. You get the give backs. So there's a lot of additional benefits that are often offered with a Part C plan. The other thing is that these services down here, these extra services, are not necessarily the same from year to year. So I was actually doing some technical assistance consulting yesterday with one of the MA plans, and they indicated that their prescription drug program or their dental program is going to have fewer procedures covered and less overall coverage in 2025 than they're having in 2024. So these services are not consistent from year to year. And then Part D is prescription drugs. And if you do not enroll in a Part C plan, then you need to get a standalone Part D plan. So original Medicare, the other thing that I wanted to kind of get a feel for is if you are looking at Part B benefits, this is the Part B benefits. And the yellow ones are the ones where there is no copay. The blue ones, there's going to be a copay. So what I want to point out is that if you are in original Medicare, you either have to pay the copay on all these blue ones, or if you are in a Medicare Advantage, you may have to pay the 20% copay, or you may have to pay a flat fee because the Medicare Advantage does not allow for a reinsurance. If you choose a Medicare supplement, which we'll talk about in a little bit, depending on which plan you take, it will cover most of these. Again, I just like to point out, because a lot of people, one of the reasons that they will use a Part C or Medicare Advantage plan is because of the preventive services. So these are all the preventive services that Part B already covers, that Medicare will cover. So again, your Part C Medicare Advantage will have to cover all of those as well. They may add coverage, and many of them do, because they will do like an annual physical, which Medicare does not. Medicare only does a Welcome to Medicare annual physical one time, basically from the time you turn 65. When you turn 66, if you miss it, you will no longer have Medicare in original Medicare pay for an annual physical. Another thing that's important as you're looking at whether to choose a Medicare supplement or a Medicare Advantage is medical necessity. So according to Medicare, the definition of medical necessity is no Medicare payment shall be made for items or services that are not reasonable and necessary for the diagnosis or treatment of illness or injury, or to improve the functioning of a malformed body member. So again, it's a fairly broad definition. Medicare supplements, because they follow original Medicare, if original Medicare pays, they use this Medicare uses this definition, they pay, and most of the time your supplement pays. If you are in a Medicare Advantage, sometimes they will interpret this definition more narrowly. So just be aware of that. Vaccines no longer have a copay. You can either get them at your doctor's office, a copay, or a pharmacy if it's a Part B benefit. That is flu, pneumonia, or hepatitis B. If you want a shingles, Tdap, COVID, or RSV, make sure you get that at the pharmacy, because those are Part D benefits. If you get a COVID shot or shingles or an RSV at your doctor's office, you'll be paying the full amount. So just a little bit on Part D and the basics of that. So this is changing in 2025. So Part D enrollees pay the deductible of 100%. Most of the plans on the standalone Part Ds have a $590 deductible. And then they have what they call the initial coverage, meaning that you pay 25% of the cost of the drugs. Now, that 25% might be paid differently depending on whether you are in a Part D enhanced plan or whether you are in a Part D basic plan. And the enhanced plans tend to have a higher deductible, lower copays, and the cost of the retail cost of the drug is included in the $2,000 out of pocket. Whereas in the basic, the cost of the retail drug, you have to pay the full amount. So in the enhanced, it's counted toward the basic or toward the deductible and costs you less out of pocket. Then the prescription drug plan pays 65%, the drug manufacturer pays 10%. In catastrophic, basically once you reach the $2,000 limit out of pocket, then you pay nothing. The plans, Medicare, and the drug manufacturers share the cost. So Part D is offered by private companies. The plans, again, they're just like the Medicare Advantage plans. They vary from year over year, whether it's embedded in the Medicare Advantage plan or whether it's a standalone plan, it still varies from year to year. They do have to cover 2 drugs in every therapeutic category. They cover outpatient prescription drugs. So again, that's what you buy at the pharmacy, or if you're in a nursing home or assisted living, you pay for your drugs. They don't cover over-the-counter drugs, vitamins, weight loss, that kind of thing. In addition to that, Medicare requires that all drugs in these 6 categories have to be paid, or these 6 drug classes. So all anti-seizure, antidepressants, antipsychotics, immunosuppressants, HIV drugs, and cancer drugs, all drugs in those classes have to be covered. Whether you're in a Part D plan or a Part C plan, they have to be covered. And the reason being because a lot of people are either in treatment or very stabilized. And so advocates fought really hard to make sure that if somebody was either getting a drug or stabilized, that they would be able to continue to get those. Insulin. So last year, insulin went to $35 per vial and or insulin pen per type of insulin. Now, not all drug companies and not all drug plans cover insulin. And insulin does not count toward the Part D deductible. Okay, so that not Part D deductible and that $2,000 out-of-pocket cap. So it's important again to understand that even though you might be spending what you consider to be a lot of money on insulin, it's not going to count toward the $2,000 out of pocket. Also, the important thing to know about insulin, not all companies will cover the pens. And if you need 2 types of insulin, say you need a short-acting as well as a long-acting plan or type, you would have to pay $35 for each vial. Now, if you need 3 vials of the short-acting each month, and you need 3 vials of the long-acting each month, you only pay for the first vial for each one. So the premiums for the out-of-pocket costs for the standalone Part D plans range from $0 on a WellCare to $151 a month. The deductibles, most of the plans are charging the $590. A lot of drugs have switched from tier 1 or 2 to tier 3 or 4 or 5. The tier 1 and 1 drugs tend to be, for the most part, a 0 copay. A lot of the tier 1 drugs, most of the tier 1 drugs, and a lot of the tier 2 drugs also do not count toward the $2,000 out-of-pocket cost. The tier 3, 4, and 5 drugs do usually count toward the out-of-pocket. And your responsibility can either be a flat fee or a percentage of the cost of the drug. In terms of diabetics, the other thing to know is that if you need supplies such as lancets, syringes, and alcohol wipes, those are all Part B benefits. You can get Part B to pay for those. However, you have to buy them from a Part B provider. So like if you just get them at Safeways or King Soopers, they're not going to be covered. If you get them, this past year, I was able to get National Medical Home Supply to provide them for one of my clients. And then they're covered under Part B. So if you do have diabetes and you need those supplies and you need help paying for them, or you want Medicare to pay for them, you might try that company, National Medical Home Supply. So now we need to make a decision. We're going to look a little bit more closely at Medicare supplements and Medicare Advantage. So original Medicare is fee for service, covers Part A and B, and then you add on a Medigap policy or a Medicare supplement to help pay for the charges that Medicare Part A and Part B do not cover, which is basically the deductibles, the co-pays, and the co-insurance. And then you, it should probably, in my opinion, say mandatorily enroll in Part D, because if you don't, you get the penalty. And so you have that combination. Or you can enroll in a Medicare Advantage plan, which is a managed care plan. And then your Part C or your Medicare Advantage includes A, B, and D most of the time, all in one plan and one premium and one provider. You still have to pay in both of these the Part B premium, which this year is $174. We don't have the amounts of what that will cost in 2025.
Oh, I have a question.
Sure.
Okay. If you don't get Social Security yet, because I don't have enough credits and I'm still working towards the credits, how much will Part A cost, do you know?
I don't have that number. That number has not been released. We're hoping it'll be out by the end of the week, but at this moment, I don't have it.
Oh, okay.
So let's look at why or what the features are, if you will, of a Medicare supplement. So basically, it's going to cover the Part A and Part B deductibles, as well as the co-pays and co-insurance for A and B, regardless of which or where you get your services. So the benefits are standardized. If you buy a Plan G from State Farm, from United Healthcare, from Mutual of Omaha, it doesn't matter. The coverage is the same. The premiums are not necessarily the same, but the coverage or the benefits are the same. You can go to any doctor as long as they accept Medicare or accept original Medicare. Then you can go anywhere in the country. You don't necessarily need a referral to see a specialist. So if you want to go see an ortho guy, you can walk in the front door and make an appointment, and you don't need a primary care doctor to tell you that you need that. It's guaranteed renewable, meaning that they cannot drop you as long as you pay your premium. So you could use $1 million worth of coverage in 2025, and they still could only charge you the same premium that they charge everybody else in your age rate band. They can't charge you more like they do for car insurance, and they can't drop you. And for a lot of people, they see this as very predictable because you know exactly what your premium is going to be every month. And you know that if you use any services, you have to pay the Medicare Part B deductible, and that's all that you're going to pay. So some people really like that predictability. The premiums for a Medicare supplement, if you're 65 and over, 65 to 69, they're around $135 to $150 a month. As you get older in the rate bands on 5-year increments, by the time you get to about 80, 85, you're probably paying about $175 to $185 per per month for a premium. Medicare supplements, they do, if you're buying a new plan, they have to give you a disclosure form indicating that you are changing plans. So if you have a Medicare supplement, you want to change to a different one, they have to give you a disclosure form. If you are moving from a Medicare supplement to a Medicare Advantage, they also have to give you a form basically saying that you acknowledge and you know that you're dropping one company and you're going with a different one. If you're new to Medicare supplements, there is a 30-day fully refundable premium. And another big feature for some people is that the healthcare decisions in a Medicare deductible, or I mean a Medicare supplement, is that the decision that your doctor makes is usually the decision. It doesn't have to get prior authorized. It's not approved by the insurance company. If your doctor says this is what you need, then basically you go get that, and it's usually covered by Medicare. The claim is submitted by the provider directly to Medicare, and then Medicare submits the claim to your supplemental, so you don't really have any out-of-pocket. All you get is basically a letter from Medicare that says these are the charges that were charged, and this is what has been approved. And then you'll get a letter or a bill, an invoice or a statement from your Medicare supplement that says this is what we paid. The rates are approved annually by the Colorado Division of Insurance. And so you can see what those rates are at their website. And like I say, they are age banded. So rates are determined either by attained age, community rating, or issue age. Colorado, we don't have anything that's on issue age, and the majority of them are on attained age. So if you go from age 69 to age 70, you can definitely expect an increase in your monthly premium. They also are allowed to rate you based on whether or not you smoke or don't smoke, whether you're male or female, and then where you live in the state of Colorado. And then the insurance commission will set basically what they call loss ratios for that area. So if you had a United Healthcare plan, a Medicare supplement, and you were in Denver, it might have a different rate if you were in Grand Junction, based on the loss ratios. The Medicare supplement, just by quick review, pays doctor bills and all other medical services. Medicare gets the bill, they pay their 80%, and then your Medicare supplement or your Medigap pays basically the excess amount or whatever's left over based on the approved amount. So just because your provider bills, and somebody asked me this the other day, she had been in the hospital and she got an $80,000 bill, and Medicare reduced it. No, wait a minute. Her bill was $34,000. She was there for an outpatient, and Medicare reduced it to $6,000. And so she paid, or the supplement paid the $6,000, and she was really sweating bullets because she was afraid that she was going to get a bill for $24,000. But the approved charge was only $6,000, so the hospital had to write off that $24,000. So it's important to know that you're dealing with approved charges, not with billed charges. This is a list of the companies that are selling Plan G in Colorado. So if you are looking to purchase a plan, you can check with one of those companies. When you're purchasing plans, my suggestion is that you purchase based on price and you purchase based on brand loyalty, because as I said a few minutes ago, the benefits are the same regardless of what you, which ones you use. If you buy a Medicare supplement, you definitely need to buy a standalone Part D plan. These are the companies that are selling in Colorado this year. And so you will need to purchase one of those as well. If you need more help or guidance on the Part D plan, we do have, it will be posted either later today or tomorrow, a standalone or a YouTube video on purchasing Part D plans. And it will be on our YouTube channel either later today or tomorrow. So now let's look at Medicare Advantage. So Medicare Advantage, as I said, is a Part C, and it combines A, B, and D. Medicare Advantage, in addition to combining A, B, and D, they can add whatever kind of additional coverage they want. So they can add dental care, glasses, hearing aids, over-the-counter items, personal emergency systems, foot care, whatever they want. Some advantages of a Medicare Advantage is that the co-pays or the premiums tend to be either zero or very, very low. Whereas in a Medicare supplement, you're looking at $135 to $150 at age 65. They do cap the out-of-pocket spending. So again, they negotiate that amount with Medicare every year. Oftentimes there are no deductibles, or if there are, they're very low. And sometimes they offer different kind of rebates or premiums, like these gift back cards and stuff like that that you've been reading about. Now, the major difference, if you will, in a Medicare Advantage versus a Medicare supplement is that in a Medicare Advantage, Medicare contracts with an insurance company. They do have to provide, as I said, the same services as the original Medicare, and they do that through a series of networks. They have approved networks. Those have to be approved by Medicare. And they're usually at least fairly substantially comparable, so that if you have one company accepting a Medicare Advantage plan, a lot of times other companies will accept as well. There are limitations that Medicare does oversee on their marketing materials. They also require quality assurance programs. So the company is required to identify what metrics they are going to be working on for the next year or two. And members can change plans annually. So a Medicare supplement, the provider basically contracts directly with Medicare. Here, the insurance company contracts, and then the provider contracts with the insurance company. And then the marketing materials and all of those kinds of things in a Medicare supplement, the companies manage all of that. The MA plans use utilization management as a way to contain costs. So a lot of times Medicare Advantage plans will use what we call prior authorization, meaning that every time a procedure, certain procedures are approved, they have to get approval from the insurance company. In a Medicare supplement, that does not exist. Similarly, they sometimes require step therapy, meaning that you have to try this first before they'll do that. So they might require 6 weeks of therapy before they will give you an injection, which then they might require you to do more therapy before they would do surgery. So they're allowed to do those kinds of things. And then they also do quantity limits, meaning that they can limit the number of procedures or the type frequency of those procedures. So for example, they may limit the number of physical therapy visits that you would get for a specific procedure that is not part of the original Medicare requirement. So again, that's a way that they contain costs. It gives them the opportunity to define, if you will, what the benefit will look like, and then how to better serve people. There are disclosure requirements now to beneficiaries for both Medicare Advantage as well as prescription drug plans. So all agents and brokers have to put in their marketing materials that they don't offer every plan available in the area, that the information is limited to those plans that they cover, that if you have questions, to call 1-800-Medicare to get the information. They have to do these disclosures not only written, but they have to do them verbally as well. And it has to be included in the first minute of the conversation. Also has to appear in any emails, online chats, or other electronic communications, has to be displayed on their websites. All marketing materials now have to be in 12-point font. So if you have seen marketing materials, like these postcards that come in the mail, you'll see that all the disclosures these days are in pretty big font, as opposed to the tiny little font. And they have to disclose it in television ads as well. Another requirement, again, for MA and PDPs is that they have to record all sales calls. So sales leads as well as sales calls have to be recorded. So if somebody calls up and said, or if you say, would you give me a call? I'd like to learn more about your Medicare Advantage plan. They have to put you on a recorded line. If you are talking either in person or on the phone, or if they're just scheduling an appointment, if they're asking you for information about your drug and provider list, they're trying to make, help you make decisions. If they're doing enrollment, follow-up calls, all of that has to be recorded. And then it goes into a recording. It's offloaded into a system maintained by Medicare, so that if there are any concerns over high pressure sales, over somebody not understanding what they were enrolling in or whatever, then Medicare in an appeal, or if they're suspecting fraud, can go back and review those recordings. There are exceptions. So if you are doing an in-person meeting for an MA plan for sales or enrollment, those do not have to be covered, so or recorded. So if you go like to a Medicare Monday event, they don't have to record those conversations that they would have with you at a table. Whereas if they came to your house, they would have to record it. If you are buying a Medicare supplement, those calls do not have to be recorded. If you, though, then start and use the same agent to buy a Medicare Part D plan, then they do have to record that part. Other advantages of Medicare Advantage in terms of their feature is that they have to provide all of the services of original Medicare. Their benefit package is negotiated every year. So just because they're doing it this year doesn't mean that they're doing it next year. And this is the add-on services. The original Medicare has to stay, but the amount of the copay, the amount that they charge for physician services, the amount for the that you would have to pay for like the first 2 or 3 or 5 days in a hospital, all of that gets renegotiated every single year. The services oftentimes will change. Again, this is all of these add-on services. The original Medicare ones will stay. Frequently, you have to get prior authorization before the healthcare decision can be made. And plans are sold either by agents or by brokers, which also sometimes gets confusing because like United, Cigna, Humana, they will sell Medicare supplements, they will sell Medicare Advantage plans, and they will sell standalone prescription drug plans. So sometimes people get confused about what they're buying because they can purchase all of those from the same agent, or they are offered by the same agent. When you're enrolling in an MA plan, there are 4 different types of MA plans that you might encounter and need to make a decision about. So the first is an HMO, where you have to use their networks. You have to choose a CPC. You almost always need a referral to specialists. They'll do original Medicare and additional benefits, usually include prescription drug plans. A real advantage of these is that they provide often something called chronic disease management, meaning that they're really sort of looking both at the home, they're calling people, trying to really make sure that you get some of the care that you need that you might not get if you were not involved. Almost all of them have all companies have at least a 0 premium. A lot have very low premiums, and there is an out-of-pocket maximum, again, that is negotiated plan by plan, company by company with Medicare. The difference of a PPO versus an HMO is in a PPO, you have to stay in the net, or you can use the network providers, or you can go outside of the network if you need additional services that you want, that may not be what you're looking for in the network, and you pay usually the 20% out of pocket. Usually they'll make you choose a PCP, but you might not have to. You can go out of network for specialists, and then they offer usually the prescription drug plan, chronic disease management, and they too will have an out-of-pocket maximum. PPOs give you a lot more options because you can use the network when it's convenient. If you need to go outside of the network, then you have the option to do that, but you do pay privately for all of the charges that are not covered. So you would pay not only the 20% or whatever for the the HMO charge or the Medicare Advantage charge, but then you'll also pay that out-of-network charges. The private fee-for-service is actually my least favorite. And this one, there is a network, and you can go out of the network for additional charges. But what I don't like about this one is that the provider, your doctor, has the choice to decide at every visit whether or not they are going to accept you as a patient and accept the fees that the company is paying. So I don't really like that one, because I want to know that if I need to go to the doctor and I've selected this doctor, then I want to be able to see that doctor and not have him tell me the next time I show up that he's not going to see me because the last time the company didn't pay him enough money for the office visit or whatever. You usually have the option to choose a primary care physician, and sometimes prescription drug plans are included, and chronic disease management, and sometimes not. Now, one that's becoming really, really popular, especially in the Front Range, is the special needs plans, or SNPs. So we have D-SNPs, we have I-SNPs, we have chronic disease SNPs, and then we have plain old SNPs. So a D-SNP, basically a special needs plan, or a SNP, is focused usually on people who have Medicare and Medicaid. So these D-SNPs is limited basically to individuals who either have Medicare or Medicaid. The I-SNPs are limited to people who, if they sell it in an institution such as a nursing home, and the C-SNPs are focused on people who might have like a chronic disease, like dialysis or chronic obstructive pulmonary disease. They're becoming very popular because the Medicare Advantage companies get higher reimbursement for enrolling people who are either full duals or what they call partial duals. So people who have full Medicaid or who have partial Medicaid, meaning that some or all of their Part B deductibles are paid by Medicare. So there's a lot of push, if you will, on enrolling individuals in that Medicaid population in these D-SNPs. You do have to choose a primary care provider. You have to be receiving Medicaid, and the provider that you see has to accept Medicaid. And prescription drugs usually are included, as well as the chronic disease management. A lot of the companies do have that as a zero premium, but they have deductibles and co-insurance. And if you have been hearing a lot of ads on TV, one of the things that these ads are usually promoting, sort of without saying it specifically, is this D-SNP. And that's especially where they're advertising like the additional benefits, like the give back card, like the card that says we'll give you $200 and you can use it for utilities, or you can use it for your car payment or whatever. Or they'll say that you can get like a certain amount of over-the-counter kinds of things, like at a specific store, like a Walgreens or something, where you can they'll give you a card, or they'll give you amount of money for like adult diapers or for Tylenol or those kinds of things. So this D-SNP is becoming very, very popular, especially with this Medicare, Medicaid crowd. A lot of people are concerned at this point in time because they may have to give up their primary care physician and go with a physician that is in the network. The other thing is that the agents can enroll these people 11 months out of the year. So whatever plan I enroll in for January, I can be re-enrolled in February, and sometimes that causes some confusion as well. So just be aware of that. Just to summarize, many plans have a zero premium, and they have different co-pays and co-insurances, so you need to pay attention to that. And then they have additional benefits, which we just went over. Part C, then, kind of the basics and the out-of-pocket charge. They may or may not have a monthly premium. They're almost always going to have a co-pay for visits to the doctor, specialist, emergency rooms, inpatient care, outpatient, urgent care. They have to pay if you go to skilled nursing days 1 through 20, but then days 21 through 100 if you need more skilled care than just the days 1 through 20, you would have to pay that out-of-pocket copay. You usually have to pay the 20% for most of the Part B services, or a percentage of the negotiated cost, such as for outpatient hospital services. So if you go back to that big chart I gave you originally with the blue and yellow squares, many times if you are in a Medicare Advantage program, those things in the blue squares, you would have to pay the 20% or a copay for. Prescription drugs may or may not have a copay, again, depending on the tier, similar to the standalone plans. And most plans have an out-of-pocket maximum. Those out-of-pocket maximums, if you're in network, this year the lowest one is $3,900. The highest one is over $12,000. So again, that can be pretty expensive if you especially are using a lot of services. If you're a low user, a Medicare Advantage plan may work very well. Things to know about a Part C plan is they will waive the Part A deductible for a set fee. So what I was seeing mostly is around $250, $350 a day for days 1 through 5 or 6 in a hospital if you have a Part C plan. If you are in original Medicare with a Medicare supplement, a Plan G, they're going to pay that Part A deductible. They have negotiated annual out-of-pocket caps. So when you reach that cap, then basically the co-pays and co-insurance are waived. Oftentimes, the insurance company will waive some of the prior authorization rules. So for example, they might waive the 3-day hospital stay for getting skilled rehab or skilled home care. One of the things to know is that if you have a Medicare supplement and you drop that Medicare supplement and you sign up with a Medicare Advantage, if you have pre-existing conditions, usually you are not able to go back to that Medicare supplement. So if you change to a Medicare Advantage, you need to understand that you will be in a Medicare Advantage program for the rest of your life, and that you are, but you can change Medicare Advantage plans. So you can go from Kaiser to United to Clear Spring or whatever you want, but you can't go back to your old Medicare supplement, usually if you have a Medicare Advantage. The only exception to that is if you are new to Medicare and you choose to go to a Medicare Advantage plan and you don't like it after 12 months, you can disenroll. Medicare Advantage plans also have star ratings, and those are determined by things like patient satisfaction, metrics that they meet in terms of things like immunizations. They also have other metrics like wound care and stuff like that. These are the Medicare Advantage plans that are selling in Colorado this year. The Longevity Health Plan and the Perennial Advantage Plan are those I-SNPs. Perennial is specifically associated with Colorado Christian Living Campus and Juniper Village. So if you're in one of those facilities, you could take advantage of Perennial. Longevity is sold out in the market, but it is only for the I-SNPs. So then we get us to making the choice. Do you want to supplement with a drug plan or do you want an MA plan? So you can go path 1, which is to get a Medicare supplement and then get prescription drug coverage. If you are worried about why you should go to a Medicare Advantage plan, and there's a lot of change at this point in time. About 50% of people are in Medicare supplements in Colorado and 50% in Medicare Advantage. And so again, it has a lot of advantages that people like. It just doesn't offer you the same stability. This is just a quick summary, if you will, of in a med sup, the doctors and hospitals, you go wherever you want. A Medicare Advantage, they have a network, and you usually have to stay in the network. If you go out, there's an additional charge. Specialists, you can see any specialist you want in a med sup and a Medicare Advantage. You'll usually need a referral, and you usually have to use their network. In a med sup, there's no networks. You can go anywhere in the United States. A Medicare Advantage has a network. Unless you're in an emergency situation, then you can go wherever and they will honor that. Enrollment in a med sup, usually people enroll either when they turn 65 or when they're first eligible for Medicare Part A and B. And that could be when they leave an employer plan as well. And a lot of people are in the employer groups these days. You can switch on a Medicare Advantage every year. and you enroll during open enrollment. The costs for a med sup, you do a monthly premium in addition to your Part B premium. And if you enroll in a Plan G, your out-of-pocket costs are stabilized. If you are in a Medicare Advantage, you have to pay the Part B premium, the $174. And then depending on which plan it is, you may have a 0 monthly premium, but then every time you use the service, you're going to pay a copay or a co-insurance. My experience is that as the younger people are and the healthier people are, the less that they will pay in medical costs in a Medicare Advantage. But when you become what I consider a high user or a high utilizer, you start having to go to the hospital more often. You're going to the doctor every month. You're going to see specialists. You're having more procedures. Then your out-of-pocket costs in a Medicare Advantage are going to escalate and up to whatever their annual maximum is. Your Medicare Part B are going to be stable because you pay your premium and that's all you have to do. Your prescription drug coverage in a med sup, you have to enroll in a standalone D. In a Medicare Advantage, usually it is an integrated benefit. Additional comparisons, again, this is just a reiteration of what we've already covered. So not really a need to go through or go over that. And that kind of concludes my remarks at this point in time regarding the difference between Medicare Advantage and Medicare supplements. Now I'll talk very briefly about a little bit of the CGS services. So we are, in addition to these Wednesday Lunch and Learns and the Medicare Monday programs, you can also request individual counseling for Part A, B, C, or D, or help with enrollment. You can ask for counseling on Medicare supplements versus Medicare Advantage, as well as help understanding Part D and the Plan Finder. Other support services that we have available is we can make referrals to private health insurance agents should you need one. You can visit our YouTube channel at CO Gerontology, and you can check out our website. Our telephone number is 303-333-3482 or 1-855-293-6911. If you do want help with the Plan Finder or enrollment in Part D, as some companies are not allowing agents to help you enroll in Part D plans, you can certainly call our office and we'll run it through the Plan Finder for you and then can help you enroll if you would like. Just a little bit about society programming. So we have a dental program that provides dental services in Metro Denver, as well as west of I-25, excluding Colorado Springs and Pueblo. Cover most procedures, including dentures, crowns, partials. We don't cover implants or fixed bridges. We have a telephone buddy program that will help people to get a telephone call from a volunteer once or twice a week to just kind of check in and make sure that they're okay and create a sense of social connectedness. We have advanced care planning with a toolkit on our website, as well as a pretty robust playlist on our YouTube channel. We are doing holiday baskets in the Metro Denver area on December the 14th. If you are low income and will be home alone for the holidays, you can certainly apply, and we'll have those applications available soon. We have the Medicare, Medicaid counseling we just talked about. If you are needing to move or you need home care, you can go to our website and click on the blue button on the homepage, and that will allow you to compare different types of housing, as well as different kinds of home care agencies. And you can always call for benefits counseling if you need. We also will be doing our Salute to Seniors August 23rd in person at the Greek Event Center, August 25th virtually. Our senior resource guidebook should be available by the end of the year. And we do a lot of work at the legislature. I'm actually going over tomorrow to testify on tax policy for renters as well as property owners. You can certainly visit our website or our YouTube channel, and you can sign up for our newsletter. So with that, I will close for today. Does